as many of our speakers today have noted in focusing on the World Health Organization. Global governance has become central to human rights implementation throughout the world. And Larry and I conclude section 2 by focusing on global health governance. Drawing on our 2018 volume on human rights and global health, rights-based governance for a globalizing world, we examine the mainstreaming of rights across the United Nations and the work of international organizations to implement human rights in their health policies, their programs, and their practices. Beginning with the World Health Organization, but looking across the wide range of international organizations that impact on determinants of health. Given the rapidly increasing number of international organizations addressing public health, which now encompasses nearly every international organization in the pandemic response, global governance has become a central basis to realize human rights and global health. To that end, these global governance institutions have integrated human rights obligations as a framework for global health policies, programs, and practices. As human rights norms and principles are increasingly mainstreamed in global health governance, Larry and I argue that it will be necessary to understand this shift in human rights obligations, from obligations of states to responsibilities of international organizations, recognizing ongoing United Nations efforts to harmonize organizational approaches to human rights implementation. But while global health governance is the passion of my life, I will, in the interest of time, jump ahead to section 3.